I have 2 elderly patients that all have dizziness and fatigue as their main symptom. Due to this population being super rigid into extension, how can I test for BPPV? So BPPV is benign paroxysmal positional vertigo, and what it is crystals inside the utricle of the ear get dislodged and come into the semicircular canals, and they rest on hair cells, which gives the person the perception that they're spinning. So the world will start spinning around them and they'll get vertigo. And this is often when people are lying in a supine position when they're on their back, because it'll activate the posterior canals and they'll start to have that vertigo sensation. There's also horizontal canal BPPV when they're laying on their side. So really it depends when you're trying to get the person into your Dix Hallpike, which is the position for looking at posterior canal BPPV. They have to have kind of 45 degrees of rotation and 30 degrees or so of extension. You can actually achieve this. When we learned this, we had their head off the table and they had to go into quite a bit of extension, but you actually don't need that. You can actually just do a little head tilt and achieve 30 degrees of extension. The other option is if you have access to some sort of tilting table mechanism, you can tilt the whole body up. So if they are that rigid and unable to achieve that level of extension, which is pretty minimal, to be honest, but if you can't do that, find some way to try and maybe just tilt their whole body up so that their head and neck can remain in a neutral position. And as long as you get that 45 degrees of rotation, you should be able to access those posterior canals. The other thing is that can be done easily is try to see if it's a horizontal canal. 85% or so of cases are going to be in posterior canal BPPV anyway, but about 10% are horizontal canal. So this is the next most common. So if it's a horizontal canal and you say that they're an elderly population, I believe in the original question you said that they were rolling around in bed and that's where they were feeling it. So just because they're not going into that extension when they're in bed tells me that it's likely a horizontal canal, or at least it could be a horizontal canal. So to test that, it's the barbecue roll or the supine roll technique. In the videos that I have on my Instagram page at Concussion Doc, I show them supine and I turn their head 90 degrees or 45 degrees or so, as much as I can get anyway in terms of rotation, directly to the side. Elderly person might not have that much rotation, so what you can do to test it, and I did this actually yesterday with somebody, I just lay them on their side. So just get them to lay on their shoulder, put a pillow under their head so their head stays neutral, and see if that invokes that downward beating nystagmus, what you're looking for. Or it could be upward beating, depending on if it's apogeotropic or geotropic. But that one you can test without having extension. If that doesn't work and you don't elicit anything, try to see if there's any way you can get them into at least just a focal little bit of extension. And if that doesn't work, try to see if you can get access to some sort of tilting mechanism to test them to keep their whole body in a rigid plane.